Hi everybody, welcome to my channel. My name is Gillian and I am currently a third-year naturopathic medical student at the National University of Natural Medicine located in Portland, Oregon. And today I'm back with another video for all of you naturopathic medical students out there. And this video is going to cover everything that you need to know about the OSCE1 examination. So if you're watching this video, I'm assuming that you're a first or second year student that's thinking about the OSCE or is currently in the process of preparing. So I hope that you find this video to be really useful. So I'm going to make sure to cover what the exam is, what the purpose of it is, the structure, how it's scored, and how I personally prepared for it. And lastly, I'm going to end the video off with some helpful tips for success. And I should mention that I passed my OSCE on my first attempt, and I really want to help you do the same. So let me just jump right in with an explanation about what the OSCE even is and why we do it during medical school. So OSCE stands for Objective Structured Clinical Examination. And throughout your time in naturopathic medical school, you'll actually have to pass multiple of these. And just as a note, each OSCE as you go through school will get progressively more complex and more involved. So the goal of these exams is to ensure that you're not only able to demonstrate your clinical skills within the standardized medical scenario, but also that you're able to make the standardized patient feel comfortable with you and that you're able to talk them through the interaction in terms that they can comprehend. Because, it's one thing to be book smart and be able to rattle off impressive medical information, but the applicability of your knowledge comes down to your ability to translate that information effectively to your patient. So as I mentioned previously, there are multiple OSCEs that you'll take throughout school, and the first is the most simple. You're not asked to officially diagnose them, give them a treatment plan, that whole shebang. That'll come later. So let me start by running through what the first OSCE involves. So please note that by the time that you are taking your OSCE exam, some of the information that I provide could be a little bit different, and it could also differ school to school. So just always be sure to use your school's resources to be up to date with the most accurate information. So I took my OSCE in April of 2023, and this was how my test was structured. So upon arriving, I checked in. My cohort was all seated in a big room where we were given instructions about how the exam was going to go. We were told to leave our belongings and take with us a writing utensil, blank piece of paper, a clipboard, and our medical equipment. Then we all walked down to a hallway with a bunch of medical exam rooms. We were each assigned a door and were told to take a seat at the chair outside of the room. And then over the intercom, we were instructed that our time of 40 minutes had begun and that we can now flip over the paper on the door that tells us the patient's chief complaint. So once the 40-minute timer begins, you must complete the following. You have to take a pertinent history, including history of present illness, past medical history, including everything from past diagnoses and family medical history to meds and supplements and allergies. Then you move along to social history and review of system questions. And then after you've gotten through your whole interview portion, you can then move on to the physical exam portion, which includes taking vitals, doing relevant exams depending on what the patient is coming in for. And 40 minutes may seem like a lot of time, but it flies by pretty quickly when you're in that room. So the goal is to be very efficient with your time. You definitely don't want to approach the physical exam portion as like a whole body exam. Just make sure to prioritize physical exams that are the most relevant to what the patient is telling you and what they're experiencing. I wanted to note that on the same paper that says your patient's chief complaint, you'll actually be given their vitals as well. So you will still have to demonstrate that you know how to take vitals, but the actual values will be on that paper. As you go through the physical exam, you can assume that your actual examination findings are correct. The standardized patient will act out any symptoms that they're able to, but there are limitations to this, obviously. They can't fake a heart murmur, for example. So in these cases, the patient is given cards with certain physical exam findings that they're hiding, and they'll only reveal to you if you do the relevant physical exam. Additionally, you're not required to do any sensitive exams during your OSCE1 examination, but you can verbalize that you would perform certain things like a breast exam or a genital exam if you feel like it's necessary, and the patient would then give you a card stating the findings from those exams. And once you're finished performing all of the physical exams that you feel are relevant to the case, you can then explain to the patient what, if any, laboratory evaluations you would like to order and why. I also really want to hammer in, always make sure that you're asking permission prior to touching a patient or performing an examination, and that you're taking their needs into account to make sure that they feel comfortable and feel respected and supported by you. And share your findings with them during these exams. Not the medical jargon that you would record in your notes, but in layman's terms, like your heart sounds or healthy and normal. So after you've completed all of the physical exams that you have time for / think are relevant, the exam is complete, and you can ask the patient any last questions you may have for them, and finish by asking them if they have any questions for you. You don't have to stay until the room until the time is up. If you feel confident that you've gathered all of the information that you need to make a list of DDXs and strategize a game plan moving forward, then you're free to leave the room early. But if you are still in the room when the time is up, you'll hear an announcement instructing you to leave the room even if you haven't completed the visit to your satisfaction. Either way, be sure to say some closing remarks prior to leaving the room. Something like, I've gathered all of the information that I need at the moment. I'm going to go discuss my findings with my supervising physician, and I'll return to you in a few minutes with more information on what our next steps will be. Does that sound good to you? Then after the 40 minutes are up, you'll then have 10 minutes to fill out some paperwork with post-encounter questions. And these questions include a section on what your top differentials are and why. It'll also ask what your next steps are in solidifying a diagnosis, what additional tests would you want to order, for example, and or just a general treatment plan. Remember, this first OSCE doesn't place such high importance on diagnosis and the treatment of the patient's condition. So after those last 10 minutes are up, you are asked to stop writing and re-enter the exam room to get some feedback from your standardized patient. They'll mostly give you feedback on your demeanor, your confidence, your rapport, if you used any medical jargon that they wouldn't understand. And this is really valuable when it comes to real-world application because, a lot of patients may not give you feedback. They just will stop coming to you or even leave bad reviews online. So after you receive your feedback, you're officially done with your examination. So you'll turn in your chart notes and any debriefing paperwork on your way out, and you're asked to not discuss the experience until you're out of the building. And then a few weeks later, you will receive your results, and your score is the combination of 3 things. So the standardized patient score for you, the post-encounter paperwork score, which is grading your differential list, your working diagnosis, your reasoning behind that list, and any basic treatment plan you've laid out. And then lastly, the global analytics score, which is all-encompassing, and it's completed by the ND who's assigned to grade your exam based on the film from your encounter. So the combination of these 3 scores will determine if you're given a result of competent, borderline, or not competent. So you need a competent grade in order to pass this examination. And if you're given a borderline score, it's subject to what is called the borderline cut score, which is the median score of all of the students in your cohort who also received a borderline score. And if your score is above the median, you pass. And if it's below, it will be considered not competent, and you will have to redo your OSCE1 examination. But, it's not the end of the world if you don't pass on your first try. In fact, you only receive a fail grade if you don't pass it twice. So you technically have 2 times to pass it. And even if you do fail it, you're not going to be kicked out of school. You're just going to have to do some extra work to prove your competency before they let you start working with patients. I want to talk briefly about the grading rubric so that you know kind of what they're looking for. So starting with what the standardized patient themselves will be grading you on. This was the rubric for my exam, so again, things might be a little bit different for you, but the patient was asked to grade me on these 5 things in particular. Did I introduce myself? Did I confirm their name and age upon entering the room? Did I immediately wash my hands or use sanitizer before touching them? Did I appropriately explain the physical exams to the patient prior to performing them? Did I speak professionally, treat them with compassion, and consider their comfort? And lastly, did I avoid medical jargon? So while the standardized patient's feedback is really relevant, it doesn't contribute greatly to your overall score, although it's definitely a factor. But the majority of the weight comes from the feedback of the ND, who is tasked with grading your film. So they take into account many factors, including the following. Did you listen to the patient carefully and put them at ease? Did you openly discuss information at an appropriate intellectual level for the patient? Did you seek the patient's consent and respect cultural and socioeconomic factors, even in situations where the patient disagrees with the approach? Did you respond consistently in a perceptive, empathetic, and genuine manner? Did you employ an approach that is organized and flexible, yet focused on relevancy? Did you effectively assess potential red flags and or critical risk factors throughout your line of questioning and your physical exams? Did you display good technique during the PEs and proper use of equipment? Did you carefully gather information before developing a reasonable diagnostic hypothesis and or DDX list? Were you able to handle uncertainty and approach it with clinical decision making? Did you consider all clinical factors to arrive at the correct working diagnosis? And keep in mind, you can still pass the OSCE if you don't get the end working diagnosis correct. Additionally, were you able to differentiate and accurately interpret normal and abnormal findings on PE? And lastly, in your treatment plan, did you give a preference to more practical therapeutic approaches that considered the patient's socioeconomic status and other factors? So that's the grading rubric of the exam, at least it was in April 2023. So now that I've covered what the exam is like and what they're looking for, let me get into how I prepared for it. So I'm going to be sharing what worked for me, but please keep in mind I structured my preparation around how I personally learn and study best. So modify it for you as you seek fit. So my game plan was to study for the OSCEs about 2 hours a day for a month prior to the exam. And I started by gathering a list of the potential chief complaints that I might encounter during my exam, which was a list that was provided to us by our school well ahead of the exam. My school's list contained 20 different potential chief complaints, ranging from heart palpitations to confusion in older adults. So I first started by researching what resources would be most helpful for me to kind of guide my prep. And I was recommended a book that I highly recommend called Advanced Health Assessment and Clinical Diagnosis in Primary Care. And I'll make sure to link that in the video description. I personally use this book as my main study tool, but I've also heard that evidence-based physical diagnosis by Stephen McGee was useful for some folks, and websites like Medistudents. As I previously mentioned, I relied pretty heavy on that book, and I'm really glad that I did because I think it's very clear to follow, and it helps you structure your approach to the exam and just kind of how you think through a patient encounter. The book is organized by chief complaints. So the first thing that I did was go through the book and tag the chief complaints that I could possibly encounter during the first OSCE. So next, one by one, I took the time to create myself a structured guide that would encompass all of the important history questions that I would need to ask, including any red flag symptoms and critical risk factors that I needed to ask about. And then review of system questions that would be relevant to their concerns, physical exams that would be most appropriate, and a differential list even based on that chief complaint. So, for example, for a CC of heart palpitations, I'd make sure to ask questions to rule out a life-threatening arrhythmia first thing, because that's an emergency condition. So some of these questions include if they're experiencing chest pain, if they have difficulty breathing, if they've recently had heart surgery, things like that. So all of these important considerations are clearly laid out in this book in order of urgency. And I love that this book doesn't just provide the questions that you should ask, but also really helpful reasoning behind why you would need to consider certain factors and what diagnoses would you need to consider on your list based on their responses. The book also will explain what PEs you should consider performing and what diagnoses certain findings would lead you towards. And it's really helpful to have a list of DDXs already in mind when you're performing physical exams, since it will help guide what exams you want to do. So, for example, if the patient is presenting with palpitations, my DDX list would include things like cardiac arrhythmia, hyperthyroidism, generalized anxiety disorder, or panic disorder, or anemia. And then, based on that list, which I only mentioned a few, I would then make sure to perform a heart exam, obviously, but I'd also look for signs of anemia by examining their nails and conjunctiva, and I would also check their thyroid and deep tendon reflexes. So I really appreciate how if you use this book to help guide your studying, you're not just going to memorize what tests you need to perform, but rather you're going to understand why you want to perform those tests and what the findings will tell you and kind of lean you towards. So after I created these SOAP note guides for myself to follow for each of the chief complaints, I then made a more general outline that I could quickly write down on a blank piece of paper with just the headings so that I didn't miss any important questions during my interview or parts of the physical exam. So I'm talking HPI, past medical history, social history, family history, review of systems, and then I had little subsections too so that I didn't miss some commonly forgotten things like medications, supplements, allergies. So once I had practiced just quickly writing down my outline, I next made some flashcards for each of the chief complaints and started by flipping over a chief complaint, writing down my general layout on the piece of paper, and then I'd fill in some more CC specific questions in the HPI and the review of systems section in order of urgency, making sure that I was asking about potential red flag symptoms and risk factors for serious and life-threatening conditions first. And next, I'd think about some potential diagnoses, and I would write down what physical exams I wanted to perform in order of importance, so that if I ran out of time and wasn't able to perform them all, I would at least get the most relevant exams done first. And once I'd gone through each chief complaint a few times and I felt confident in organizing my paperwork and my general approach, then I started studying with some of my fellow classmates and taking turns being fake patients with each other. So we recreated the exam as much as possible, which I highly recommend. I think in general, the more closely that you can recreate how you'll be tested while studying, the better. We studied in a group of 3, which I'd recommend because one person was acting as patient, one as doctor, and the other as the observer who's following along with a study guide. And I think this was a really good system because the observer can make notes about the interaction on what was missed, and the patient can just focus on how the interaction made them feel versus being in the mindset of a medical student. So we would set a timer for 40 minutes and the doctor would be given the chief complaint of the patient. And I noticed that some of my friends took a similar approach to me by organizing their paper for a few minutes first before entering the room, but others choose to just start the interaction right away. It's really a personal preference, and I will say that a professor of mine who's graded many OSCE exams over the years said that she really hasn't noticed a trend in pass or fail rates for those who immediately enter the room or, those who take a few minutes to write out their game plan. So do what works best for you. So, back to what my friends and I did to prep, we would practice interviewing our patient and perform relevant physical exams. And once we were all done, we would report to the observer what we would include on a differential list and what we thought the most likely diagnosis was. And the observer would then tell them the actual diagnosis that the patient was recreating and anything that the doctor may have missed. And the patient would then share notes on what the doc could have done better in terms of how they interacted with them, if they used too much medical jargon, if anything was uncomfortable, etc. And the very last thing that I did to prepare for my exam was to attend physical exam open labs at my school to practice the various physical exams that I could potentially perform during the OSCE, which I think was really helpful to ask some clarifying questions and to fine-tune my skills. It's much different performing the exams than just running through them in your head, so make sure you get that hands-on practice. And then, as I mentioned before, I started studying for about 2 hours a day for the OSCE 1 month prior to the exam. And for me personally, this was a good timeline, but adjust it depending on what will help make you feel your most confident going into the test. And don't forget that really you've been studying for this test the whole time that you've been in school so far. So studying is really just fine-tuning your skills and practicing applying your skills and recalling really what you already know. And remember, the first OSCE is really about assessing your thought process and your abilities to function appropriately in a clinical setting. So don't stress yourself out too much about being able to correctly diagnose the patient's condition at this point. Focus more of your energy on the interviewing and physical exam skills. Alright, I want to wrap up this video by sharing some tips for success. So while you're studying, try to recreate the exam as much as possible. Time yourself, flip over a paper with the patient's chief complaint, start with a blank piece of paper, practice organizing your interaction on paper if that's helpful to you, and practice with classmates as much as possible, and practice those exams hands-on. Another tip that I have for you is don't skip washing your hands, or at least faking it or verbalizing that you would while you're practicing for your exam. Make it a habit so you don't even need to think about it on the day of, because that's a very commonly missed thing. So you need to remember to wash your hands immediately upon entering the room, and then also before you touch the patient to perform any vitals and PEs. A really helpful tip that was shared with me that I used to make sure that I didn't forget to wash my hands that second time before vitals was to put a paper towel as a reminder in my medical equipment bag on top of my equipment so that I had to remove it before grabbing my equipment, and that would be a trigger to remember to wash my hands. Another tip that I have for you is to get a wristwatch for the exam if you don't already have one. It's really useful for taking the patient's pulse and respiration rate and for making note of the time also throughout your encounter to help pace yourself. Try your best to forget that that person is an actor as you enter the room. Pull your shoulders back, smile, and go into it as a fun opportunity to show off your skills. Also, during the interview portion, if your patient makes a comment about their pain, their discomfort, or, some concerns they're having, address it in a meaningful way and try to ease their concerns and provide some comfort rather than just ignoring it and continuing on with your line of questioning. Same thing goes for, if during the family history section or the social history section, they mention some sensitive personal information such as death of a loved one, offer your condolences, don't be a robot. And onto the physical exam, make sure to clearly ask for consent before touching the patient and before performing any physical exams. And throughout the physical exam, tell your patient what you're going to be doing before you do it and to notify you if they experience any pain or discomfort, and make sure to explain your findings generally in ways that they can understand. Anytime a patient hands you a card with information during the physical exams, you are responsible for recording that information on your chart paperwork, since you're actually not allowed to take those cards out of the room with you. So this is really important because at the end of the exam, you have to fill out post-encounter paperwork where you'll list what findings make you suspect certain diagnoses. And if you didn't write down the findings, it's probably going to be really hard to recall them. So when you finish your exam, odds are that you'll start going over and over in your head what you missed, what you could have done better, blah, blah, blah. but you can't do anything about it now, so just focus on the fact that you did the best that you could and try to forget about how you performed until you get the results back. There's no point in stressing about it until then. And the very last tip that I want to share is the importance of being confident in your own abilities and staying in your personal zone during the exam. I was actually the last person to enter my room because I organized my SOAP note first before entering, and I made sure to write down all of the important do not miss questions and concerning risk factors to rule out. And I didn't run out of time in my room with the patient, and I got feedback that my line of questioning and my exam was streamlined and well organized. But again, take an individualized approach to this exam and don't panic about how others around you are approaching it. So that concludes my tips for the exam. The OSCE1 examination is really the first exam in ND school aside from our tests in our courses. And I know that it can be intimidating, but if you focus on framing the way you see it as a fun opportunity to showcase your abilities, I think it becomes less daunting. I really hope that you found this video to be helpful. I am definitely going to continue to document my experience in ND school as I go through it, so please be sure to subscribe to my channel if you want to be notified when I post more videos. And as promised, I've linked some helpful resources below in the video description. I wish you all the best on your exam, and I'm excited to be fellow NDs one day.